what do you feel that K-Laser's added to in regards of the orthopaedic cases that you see here?
I felt that it's let us see a lot of the orthopaedic cases back, so we can monitor their progression and how they're healing, especially the wound, how they're getting on at home in regards to the medications and the actual healing of the orthopaedic side of it as well.
Okay, and have you seen an acceleration through that, or how's it helped you with those cases as a rehab tool?
I find that they've healed a lot faster. We've had a lot of clients that say they've healed a lot faster. We've had some that have done, if they've had bilateral problems, that the one leg they didn't have the K-laser on compared to the other leg, they've seen much more progression with the one they've had the K-laser on. So.
And Amy, from your point of view, obviously you're a veterinary nurse, but you're in charge of a team here as well.
Yeah.
So how's that worked with you, both within the vets and coordinating with them, but also within your fellow colleagues in the nursing team?
So it's quite nice for the nurses because we get to see all the cases back and we get to sort of build up a bond with the clients, so they start to trust us a lot more and they come in a lot more regularly and they speak to us about sort of any other issues that might be coming up that they wouldn't have necessarily rung us about. So obviously if something comes in, they might say that they haven't been eating and there's something else that they haven't been doing, and it's just a chance for us to sort of catch up and have a nice chat with them. And obviously for the team it means that we get to know our patients better and we can provide a better standard of care, getting to know them as individuals.
And does it help working alongside things like weight management clinics?
Yes, definitely. So we obviously run our weight clinics here, which goes quite well hand in hand with our sort of osteoarthritis clinics, and the K-laser is offered as part of sort of a package deal with each of those clinics, and it means that sort of when they come in they're getting used to the people that they're seeing, they're receiving their regular K-laser and we're monitoring their weight as closely as we can be.
And previously with the weight clinics, were you charging for those?
Yes.
You were charging for those?
Yes,
okay,
we charge for our weight clinics.
So with the K-laser then there's additional income that comes in from that?
Yeah, so there's additional income that comes in with the laser. We do sort of tend to do them as a package deal, so we do 6 at a time, and then sort of we'll see how the patient is getting on. Some patients, they'll come in sort of every week, and other patients we have come in sort of every 3 months, depending on sort of how stiff they get or how well they're coping with their arthritis. The client will just sort of give us a ring and let us know when they feel that the patient's going to benefit from another session.
And just, I think you've had some nasty skin cases as well, haven't you? And you've seen some benefits there.
Yeah, definitely. Specific in our MRSA case, pretty nasty wound, and it did really help the wound healing, and it did help it a lot. Dried it up quite a bit, which was really helpful.
And in combination with antibiotics and
yes, yeah.
Okay. And in regards of the concertina, so you can get animals, because I know Russell doesn't like animals going for hydro too early, but it allows them to go a little bit earlier when they use the K-laser so that the rehab can start quicker.
Yeah, so I think it's nice for them sort of initially, because obviously we do the initial K-lasers over sort of a couple of weeks, which means that the initial wound healing, the initial sort of healing after a surgery, that's all sort of being completed by then. They're having regular check-ins with the nurse, so the nurse can let Russell know sort of how they're going in their rehab programme, and then obviously once their laser sessions are complete, they then come back in to see Russell, and Russell can sort of assess them, and obviously if they've progressed faster after having the K-laser, it means that they can go for all these extra physios a lot sooner, sort of speeding up the recovery process for the patient and allowing them to be a lot more comfortable a lot sooner.
And have your nurses found it easy to use, but have they also liked the more patient contact? How's that changed the nursing team attitude?
Yeah, so it's relatively easy to use. Obviously it depends. We have had some cases where obviously if you are a little bit unsure of sort of which settings and things to go by, there's always sort of additional support and things. But overall I think the majority of our cases, they're quite easy to laser, and obviously they're coming in regularly, so we can sort of adjust their programs to suit them, and sort of speak to the client and find out how they think they're getting on, see how they're doing at home. And it means that obviously if we've got a better idea of how they're doing, we can adjust their K-laser sessions to suit them, which is easy enough to do on the machine. It's very straightforward.
And have your nurses like that
use.
more hands-on
Yes.
actual therapy aspect? That they
Yeah,
do?
so it's a lot nice for us to sort of be able to do our sort of nurse clinics, get to know people. Obviously it gives us a lot more chance to get to know our patients, get to know the clients, just build up a bit more of a rapport with them. So they feel a lot more confident in us and being able to sort of speak to us and ask us questions, which necessarily they may not have done if we hadn't been able to get
Definitely
them in for the
more
clinic.
open with nurses than they are vets, so I find they're a bit always scared of the vets to ask questions. They'll obviously come out of the consult room with the vets and come into us and ask questions that they might not have asked the vets, and things that they probably weren't sure what the vet was saying but is too worried to say. So it gives us that time to just sit down, gives us 10 minutes to just sit down and they can open up and talk about their worries and with the patient.
Excellent, thank you so much.